Along with the world's gradual recovery from the pandemic, schools have begun to transition to hybrid settings where online classes are blended with limited face to face classes. Internet accessibility, affordability, and reliability in certain areas seem to negatively affect the delivery of nursing education during the COVID-19 lockdown. Good day, viewers! Our hard work for this study over the school year has finally come to an end. Today, presenting to you is Arabella Muñoz, and together with me are my groupmates.
I'm Ian Rafael A. Malapitan.
I'm Marie Mallon.
I am Al-Shaeed Muntasil.
I'm Jacqueline Olegon.
We are from the BSN 3E Group 4A of the College of Nursing from the University of St. La Salle, Bacolod. And we present to you Lived Experience of Nursing Students' Clinical Exposure in the Delivery Room.
Purpose. This study included identifying learning gaps and students' personal perceptions of their experiences in the delivery room. The purpose of the study was to obtain information about the thoughts and personal experiences of nursing students who participated in their delivery room clinical exposure post-pandemic, as well as to contribute to the knowledge in identifying issues that emerged in order to more effectively create solutions for the future of nursing education. Methods, the research design. The method used in this study is qualitative research in phenomenological approach. This approach examined the lived experiences of nursing students in the delivery room despite the challenges of online learning. Through this method, establishing rapport was easier, which encouraged participants to generate a more in-depth response regarding their experiences.
As for the participants, in this study, Level 2 and Level 3 are chosen as participants for the very reason that these batches experienced their first year and first 2 years of nursing education via online learning respectively, whereas the Level 1 did not and Level 4 experienced face-to-face in their first year before they transitioned to online education for 2 years. The participants were chosen using purposive sampling. The criteria of selecting the participants: first, either male or female; second, ages between 20 to 22; third, studying Bachelor of Science in Nursing at the chosen university; fourth, currently enrolled as a Level 2 or Level 3 student nurse; and fifth, had clinical exposure in the delivery room with handled SEs or newborn care case or cases.
For the research instrument, the data were gathered through conducting an in-depth interview with the researcher-made interview guide, which has 3 parts. The first part includes the student nurses' demographic profile, which includes their age, sex, year level, and delivery room cases. The second part includes the overarching question, and the third and final part includes the probing questions regarding their experience during their clinical exposure in the delivery room, such as how their performance was and the feedback they've received.
Moving on to the study's results, 4 themes have been identified with 2 accompanying sub-themes under each of them. Theme 1, first-hand experiences in the delivery room, highlights both the positive and negative experiences of the participants during their clinical exposure in the delivery room. The sub-themes under this theme are 1A and 1B. Sub-theme 1A, positive clinical exposure experience, covers the experiences that provided a satisfactory and fruitful learning experience for the participants. Sub-theme 1B, negative clinical exposure experience, covers the limitations experienced by the participants that prompted feelings of disappointment and frustrations. Theme 2, challenges encountered during clinical exposure, focuses on the challenges faced by the participants during their clinical exposure in the delivery room. The sub-themes under this theme are 2A and 2B. Sub-theme 2A, difference in academic and actual clinical setting, covers the gap between theory and practice, the procedures in course delivery from an academic standpoint compared to that of how one operates in an actual clinical environment. Sub-theme 2B, lack of hands-on experience due to COVID-19 restrictions and shed policies, covers how lack of hands-on practice draws anxiety on students and reduces confidence in performing certain procedures in the delivery room. The lack of actual simulation is due to CHED's order, which states no face-to-face classes shall be held during the COVID-19 pandemic. Theme 3, clinical instructors' influence on students' clinical exposure, highlights the impact of a clinical instructor on the student's experience in the delivery room. The sub-themes under this theme are 3A and 3B. Sub-theme 3A, assistance or guidance from the clinical instructor, covers how the self-confidence of students increases and their performance runs smoothly and the result of the attentiveness of a clinical instructor when guiding them. Subtheme 3B, Performance Feedback from Clinical Instructor, covers how feedback can assist students in improving their skills and performances, especially when delivered respectfully. Last but not least, Theme 4, Learnings in Clinical Exposure, focuses on the acquired learnings of the participants in their clinical exposure in the delivery room. The sub-themes under this theme are 4A and 4B. Sub-theme 4A, Attitude Flexibility, covers the attitude that makes a good delivery room nurse, precisely those that are versatile and innovative. Sub-theme 4B, Skills Learned from Experience, covers how experience honed the participants' skills with time as aspiring nurses.
The conclusion. First, the participants consider the clinical exposure successful because of positive clinical exposure experiences, which the students deem memorable as learning experiences. Second, the gap between theory and practice proves to be a challenge in performing procedures in the delivery room, as most are used to the online modality due to the pandemic and as the institution gradually transitioned to face-to-face classes or clinical exposures. Third, having clinical instructors who are attentive in guiding and assisting students, able to provide criticisms respectfully, recognitions and compliments encourages them to perform successfully. Last but not the least, experience is an effective method of learning, and that working in the actual hospital setting actually improves one's skills and increases one's confidence in their ability to apply what they have learned in subsequent procedures.
The researchers recommend the following. For the College of Nursing Administrators, invest in simulation resources and create various simulation scenarios to simulate real-life situations. And finally, ensure that student nurses participate in return demonstrations and actual simulations prior to their clinical exposure. For the clinical instructors and professors, maintain a healthy teaching-learning relationship with the students and develop desirable attitudes such as patience and being approachable so that students will not hesitate or fear to ask questions or seek guidance as they perform tasks in the delivery room. For the student nurses, be diligent in studying the procedures and learn to be flexible while on duty and anticipate scenarios that are not typically expected to happen, and learn how to reduce feelings of anxiety and fear that may interfere with their performance. And lastly, enjoy and learn from the experience. And for future researchers, identify other variables not included in the study and focus on the phenomena that significantly affected the situation or caused the circumstances to occur when investigating the participants' lived experiences during their clinical exposure.
That would be all for our research presentation entitled Lived Experience of Nursing Students' Clinical Exposure in the Delivery Room. Thank you for your time.